Well, hey everybody, thanks for taking the time to be um, on this webinar today. I think I'm allotted about 15 or 20 minutes for presenting an update on our working group, and that's along with Regina Birez, who just chimed in. If you were here already, Regina Birez, do you want to just say hi one more time now that we're recording?
Oh, yeah. Thanks. Hi, I'm Regina Burris. I'm co-chair of this working group with Chris, and I'm trying to connect. I have WebEx issues. Sorry.
Yeah, and Regina is at the NIH, and we're the co-chairs of this working group. And let's see, we started about, or maybe exactly a year ago. And we're the working group on climate and health. And I will move forward. So just a reminder, if you, I guess if you maybe this is a conglomeration of all the US CLIVAR panels, so you probably don't know this, but we have a pretty interdisciplinary working group. This is a list of um, our members. We have 18 folks, including Regina and I. And like I said before we just started, I've been a part of US CLIVAR for a while on some working groups and panels and the SSC at one point. And this is really kind of a novel thing, I feel like, for US CLIVAR get to be quite this far out there in terms of interdisciplinarity. I'd say about half the folks on this list are lean towards the climate science, or I should say, come from the climate science. In terms of education and their career trajectory, and then the other half come from health sciences. Some of them have MDs. A lot of them are PhDs in the sort of public health space. I was thinking about putting a little C or H next to everybody's name so you kind of knew, but it's almost impossible with some of the folks. Like, I'm obviously a climate scientist who dabbles in health, and then there's other folks like maybe Regina, you would possibly classify yourself as health first, and in recent years dabbled much more in climate. So we all sort of,
hmm
everyone on this list now does both, but you kind of have to come from somewhere. So it's a really fun group to work and talk with, and we have just amazing conversations on our working group calls. I think the first thing I learned, and Alyssa, if she's on this call, yeah, knows exactly what I'm talking about here. The first thing is, if you think it's hard to get a call scheduled with a dozen climate scientists, yeah, your doodle poll game, it has to be on a whole nother level with this group of people. So that can be a little, I'll say out at the outset here, that can be a little bit of a challenge, honestly, for a working group, because we try to have monthly meetings, and we do. Oftentimes we'll have just a subset of the group, half or a majority of the whole working group, and that can present challenges in terms of keeping a consistent flow of the discussions from one meeting to the next. But it's fine. It's a really fun group to talk with. Okay, and so I won't give the whole spiel from when we pitched this, but just quickly review the objectives here. We have three objectives. The first is about data management, accessibility, and integration across the climate and health sciences. I won't go into the details. The second is developing best practices for incorporating climate uncertainty into climate-driven forecasts and or projections of health outcomes. And these are the two objectives I'd say we've been chipping away at the most over the first year of the life of our working group. And by the way, Regina, if there's any point you want to jump in on anything, please just feel free. Our
Yeah,
third
I will.
objective, okay, thanks. Yeah, our third objective is to identify research gaps in future programs that are key to the development of the workforce underpinning this crucial research enterprise. There's a lot of challenges there, as you can imagine, coming through PhD programs that are ultimately kind of focused on one or the other. Funding programs tend to be a little more siloed, and so that's a big ambitious goal that we want to address, but I don't think we've really started to tackle that one quite yet in our first year of our working group here. So those are our objectives, and I guess I'm sort of structuring the presentation around the recap of the meetings, which doesn't look very much fun. But the first wave of meetings that we had starting in August of 2023 last year, that was when we kicked off. Um, and let's see, we've started documenting. I mean, I can share this document we have if anybody wants, but we worked kind of collectively on documenting broadly the all of the working groups, government programs, international organizations, professional societies, university programs, whether they're master's degree programs or whatever, consortia, journals, funding programs, and kind of collating all of these into a rapidly outdated, I'm sure, document. But it just kind of that helped us to get a view of the landscape because we're, you know, just another working group, but on climate and health. But it's just actually kind of amazing to look at how much is going on out there and where we fit in and ways that we can partner with existing opportunities. So we've put that together. That was one of the first things we did. The next couple of calls were very um, less structured, just kind of roundtable discussions about, the first two, mostly the first, but the first two objectives, thinking about data management, data sharing protocols. Uncertainty is all over the prospectus for this working group. So we talk a lot about uncertainty, both largely in terms of the climate data so far, but also uncertainty in the health data. So that kind of consumed the next couple meetings. And then with one of our objectives, and we just flip back a couple, one of our objectives, or the first two, really involves writing a paper of sorts, both in terms of emphasizing these issues with data management, accessibility, but also best practices. And so the we started formulating ideas for such a paper around December in that meeting. This line here is gray because it's not a working group meeting per se, but that I believe that was Regina who gave an update of our working group to the NIH Climate Change and Health Steering Committee. And then
Yeah.
yep. And Regina, is there a couple words you want to say about that, or?
Well, yeah, the NIH Climate Change and Health Steering Committee is very interested in working with climate scientists to better understand climate data and how to integrate climate data with health data and better appreciate the challenges there. So that's one of the underlying themes of our working group, and we've had a couple of in-depth discussions along those lines, including using some of the same terminology to mean different things. So some of our meetings we do a little translation. Um, you know, so yeah, the NIH leadership on climate change and health is very engaged in what we're doing in this working group. Over.
And I should say that this working group is also unique in the sense that NIH co-funds it, which I think is another new thing for US CLIVAR. We've really brought NIH program management to the table, not as membership of the IAG, but in a way more involved than ever, and hopefully part of the process of building the bridges in that third objective is being chipped away with through that partnership. Okay, so then the next couple of working group meetings, we started actually working on a paper. And I'm going to show you some kind of just screenshots and snippets. I don't know a better way to do this, but the general idea behind it initially was to have one community lay out in a useful, accessible, friendly sort of manner. Speaking of translation, that Regina just mentioned, we do a lot of translation on our calls too. Sort of a hitchhiker's guide to actually using the data and models of the other communities. So one concept was right, have the work together. It takes both communities, even if it's a paper that's sort of explaining the data and models of climate science to the public health community. You need the health sciences folks to be a part of that process, because the climate sciences folks, we're going to struggle to know what the pain points really are, what the applications are, especially, and exactly how you want to use the data and model output, and how do you or do you not consider uncertainty in the use of the data and models. So there's more meetings that I'm going to talk about next, but this is at this point we had sort of started drafting up a paper. We were calling it cross-disciplinary perspectives on harnessing climate data in health research. So as you can see from the title, it's like written for the health research community by us, which includes, half of our working group or so are climate science researchers. And sometimes I'm using past tense when I say it, the title was this. I'll comment on that in a second. But here I'll just pull out this excerpt here. Um, so it offers the shared perspectives of a group of climate health scholars on process of integrating climate data into health research. The objective is to communicate some of the key challenges faced by researchers engaging in this enterprise, discuss some of the nuanced considerations involved, and describe some pathways to successfully navigating these issues towards robust and insightful research outcomes concerning the myriad impacts of climate change on human health. Um, and so uh, down here, you can see where we started to wonder, should this paper be just in the direct flow of information from climate community to the health community, or should we try to do both in one paper? Have also talk about health data for climate scientists who want to use those data ultimately. And I think we're still we're still not in total agreement on this yet, and that's okay. But ultimately, the idea to write a pair of companion papers came up, which um, does sound like an interesting idea. A pair of companion papers, kind of referred to here. Um, it says here, in our companion paper published in PLOS Climate, we flip the table around and address the climate science community, offering our perspectives on the challenges and opportunities involved in acquiring and appropriately analyzing and interpreting health data sets. So yeah, pull back the curtains, blah, 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 cross-disciplinary. So we're still kind of working through what route to go, but it might be a pair of companion papers, one published in, say, GeoHealth or PLOS Public Health, um, or Lancet Planetary Health, somewhere where it's going to reach the health sciences community. And then the companion paper would be in a similar journal like PLOS Climate or whatever it may be, addressing the climate science community about health data. And this is definitely something that we would love input and ideas and reactions from the group of folks on this call from the different US CLIVAR panels. Anyway, if we go in this direction, the way we kind of envision structuring it, and here's where it gets a little outliney. Section 2 would be this was kind of before we split it into a pair of companion papers, but a primer on health data and climate data needs, the needs of those data to support discovery. And then a big, robust primer on climate data, where we talk about, observational data sets, satellite data sets, reanalyses, even just what are reanalyses, and climate model outputs, observations, reanalyses, outputs. And then a bulk of the paper would be these use cases that we as a working group have concocted, somewhat hypothetical use cases, but also not entirely hypothetical, things that we as researchers are working on or have worked on or want to work on. Of course, not giving away our best idea that we're about to work on or anything like that. But so, just as an example, a use case would be researching climatic controls on epidemiology. And so we'll kind of like set up um, this scenario. I'm an environmental epidemiologist with 20 years of incidence records of a vector-borne disease at the epi-week level. So if you're a climate scientist, you probably have no idea what that means, and that's part of the fun in all this. For these 100 square kilometer districts across a developing country in the tropics. That is, so we're being specific about temporal resolution, spatial scale, tropics where some dynamics are more important than others. And I want to use climate data to identify the drivers of this disease, but I don't know where to start. And so these use cases are kind of a vehicle for us to, in a more engaging way, write about some of these nuances, about resolution, scale, the source of data, uncertainties, whether it's observational uncertainty or, you know, um, in the case of this second use case, planning for extreme heat. Where are we going to be planning? Uncertainties in terms of seasonal to interannual forecasting. This is just another one. I'm the mayor of a major city, or the environmental health czar of a major city. How many cooling centers do I need to plan for this coming summer, and where should I deploy them? And so we're kind of going through articulating these, and we're picking use cases that might allow us the most chance to go through and shoehorn in the big points we want to make about best practices in the use of climate data, but also just a general understanding of where it comes from and what the uncertainties are. So there's a bunch of other ones here. One of these is in collaboration with the Coast Coasts and Climate Working Group. Um, and we've put our heads together with them. Our co-chairs had a meeting with their co-chairs, and we're planning to collaborate on with them, and get their help and on one of these use cases. Okay, so that's kind of the idea behind that paper. At that point, maybe because we just couldn't you know, come to a conclusion about what the best path would be for that paper. But maybe it's going to be a pair of companion papers. We said, let's take a step back for a minute, and have a few of our monthly meetings where we tap various people, some of which are internal to our working group and some are not, and get their frank experiences and challenges with data and uncertainty. So that's what the next meetings here that just showed up: March, May, June, July. And these have been really useful, where we can really just dig in to the challenges that are faced, and oftentimes a lot of really interesting questions and suggestions for the researcher themselves comes out of these discussions. It makes me think all climate and health research projects would benefit from kind of a panel like this, where we can give insight into some of the things that the researchers may or may not be aware of, or what have you. And I have a couple of highlight slides from these, but I think I'm running out of time. Our upcoming meetings, the next one in next month is going to be with Titus Schleier, who's the chair of the American Medical Informatics Association's Climate, Health, and Informatics Working Group. Let's see. I better skip these. These are just some highlights of some of the talks, but I just one word
Mhm.
about this. If you're interested in using the CDC data, and I forgot the acronym for this particular data set, but it's like, don't don't make a plan for your master's student to build their research on it, because
Yeah,
it takes like two
yeah.
years, it sounds like, even to be able to look at it. And then when you get this access, you have to figure out how to run all of your analysis on their computers and forget about MATLAB or even Python, it's this PhD student John Nicholas deserves for a monument to be erected in his honor for his persistence in going through this, getting secret sworn status and figuring out how to convert Era 5 into SAS format. Anyways, that's a major pain point. We heard from Elizabeth Frankenberg, who was doing this, presented some insights from a study she led that looked at the impact of coastal flooding on post-traumatic stress and traumatic exposure, combining AdCirc modeling of significant wave height and flood coastal inundation with boots on the ground surveys in the communities that were affected by hurricane related flooding. And Kai Chen, our most recent working group meeting, he presented on temperature exposure, combining it with global climate model outputs. We had a hearty discussion about uncertainties and, largely centering, as if my memory serves me, on the role of internal variability, which can be that's even, the climate science community hasn't appreciated fully that uncertainty as long as we probably should have. So this is also very, um, a sticky thing to wrap the head around for anybody doing research on this. And so how much of the uncertainty comes from RCPs and models, and oftentimes something like internal variability isn't even included in some studies. So the last thing, we have a couple of conference session proposals. Both were accepted, one at AGU and one at the upcoming AMS meeting. So we hope to see you there. I believe that's last slide I have here. So definitely excited to hear your questions and suggestions concerning the paper and anything else.
I'll jump in and add a quick note about the federal statistics research data centers. I mean, some of that is being close enough to one and connecting with folks that can help facilitate the process. The other thing is the inherent difference between a lot of the human subjects and federal statistical data and the climate data. So to add climate data to your human subjects data, you need PII. And so that raises the level of security required significantly. So it's a very different perspective in terms of data access and data security. And that's what we run into in bringing the two together. Over.
Awesome. Thank you for that presentation. So if anybody has a question, you can use the raise hand feature. And okay, I see Dylan.
Hey, Chris and Regina. First of all, I just want to say congrats on like launching this off with so much enthusiasm. Looks like you guys had a really productive year. So it's been really gratifying to sort of see this come from, the seed of the idea that we had a couple years ago to like where you are now. It's really cool. I had a question pretty specific to the PPAI panel. Chris, you and I had sort of talked about this a little bit over email, but I'll just sort of reiterate it for the broader group. But PPAI is putting together a white paper on the benefits of hindcast systems in climate science and the challenges that those systems are currently facing in terms of availability, development, and maintenance. And as part of that white paper, we're trying to highlight to what extent hindcast systems exist for climate health at the intersection of climate and health. So things like, malaria hindcasts that are forced by model output of like precipitation and surface temperature, that kind of thing. So I guess I'm just going to pose the question a little bit more publicly for Chris. I know you reached out to the group, to your working group. And Regina, if you happen to know of anything as well, that'd be great. But I just wasn't sure if you guys had sort of come up with any examples that we might be able to include in that hindcast paper.
Yeah, Noah, Noah. Dylan, I was looking at the word Noah. Dylan, I passed that question along to the working group, and I think I didn't get any responses since then. Maybe it was last week, and I encouraged them
I
to
saw that.
contact you. I don't know if you did, but no, I've got nothing from that at this point. Yeah.
I'll ping Lee from NIAID. He may have something for you guys. So I'll pull that out of my email, Chris and Dylan, and I'll try to sort of see if Lee can add anything to that.
But
Okay. Yeah,
you're
and
looking for
go ahead, Chris. Yeah.
Oh, so just so I understand though, you're looking for examples of applications of hindcasts, but where hindcasts from climate, weather, environmental data are used in hindcasts of health outcomes, right?
Yeah, basically, or even examples of just sort of operational forecasting tools that are used in the climate health space. So like it could be an operational malaria forecast on any time scale,
Yeah,
subseasonal or seasonal or that sort
I
of thing.
think that's always the goal when we do the research is figure out, what's the exposure response function, and then have credible forecasts or projections to pump into that and get your answer for what the response is going to be in days, weeks, months, or whatever it may be. But I mean, early warning systems, there are many early warning systems, but your question is specific to hindcast studies of or where they've evaluated the veracity of those early warning systems, essentially using the hindcast method that is pretty typical in our line of work. Yeah,
Yeah.
I'm not
I mean,
familiar with any.
okay, sounds good. We
I
can
wonder if
follow up
people
over
have
email.
done this in private foundations, such as the Gates Foundation. We ask around because,
Mhm.
right, there are
Mm.
private foundations that are totally devoted to like malaria and climate or something like that.
Mhm. It's a great idea. There's also the Burroughs Wellcome Foundation, and I have
Yeah.
I collaborate on a grant. They have a climate, it's called CHI, Climate and Health Initiative. And yeah, they do a lot of vector-borne disease, climate work. Probably, being foundations, like you said, Arena, it's like they're looking to change the world, not just to, make fun publications for us. So that would be a good place to look.
Awesome.
All right.
Thanks.
I think we have time for maybe one more question if nobody has to leave from Sanjeev.
Yeah, I agree with Dylan that this is a lot of work putting together these two different communities. I think in our group we talked a little more about climate for all, and I would expect in climate and health working group this matters little more. Like 95-degree temperature does not affect the same. If you have AC and air conditioning car, you should be fine. But if you are like more than 40 minutes outside with coming back to home, so did you get a chance to deal with those kind of race, income disparity, and related issue in when it comes to the health? Yeah, I had this topic there.
Yeah, it comes up a lot actually, and I'll try to remember some of the researchers on our working group who addressed that. But Elizabeth Frankenberg, who did the study on the sort of post flooding, human response to hurricanes, that's a large dimension in her study. But also Lee Newman, who's a he's an MD, but he studies worker health. So he looks at chronic kidney disease of unknown origin, so an emergent issue in the tropics, and so like that's all about sugarcane workers who have a very different exposure to heat than like you said, Sanjeev, like people who are inside and have the capacity to mitigate it with like air conditioning and stuff. So this does come up a lot. So I don't know if race has come up, but definitely like socioeconomic status and which is tied in with types of labor, the type of labor you're involved with, and then the exposure. So it comes up a lot. I can imagine this expanding maybe in our paper on health data, because that's where that information would be to overlay into research projects. Regina, any thoughts on that one?
No, I think, yeah, the importance, the interaction between heat and occupation is a big one. Some of these occupations, that work outside a lot, there's a number of health risks that accumulate, over the years. So that's definitely an area for, with opportunity for exploration and collaboration.
Yeah, and I think we're lucky to have at least a few people on the working group who that is, where their own research program in their lab at home is that's a big part of their research. So that should come out.
Thank you.
Thanks, Sanjeev.
All right, we're about 5 minutes over, so just to respect everybody's time, I'm going to say thank you very much, and that'll end the question session. There's a couple questions in the chat that maybe can be answered offline, and I can share those with the working group leaders. So thank you again, Chris and Regina.
Thank
Our
you.
pleasure. Thanks.
Bye.
And yeah, thank you everybody else. And join us for our next one coming up on July 24th.
Bye, everyone.